the saliva test is there. There's just no reason why a small child cannot take this test. It was in the judgment of some parents, and I don't want to criticise parents for, for making a judgment that it would have been unreasonable for their young child to be involved in that nasal test. But now I think that's no longer an issue. With the saliva test coming on board, with the orders having been changed last night, then everyone will be tested, and if they're not, then their stay will be a 24-day stay, not a 14-day stay. No, obviously the Doherty, which all Victorians and indeed all Australians can be very proud of, it's taken some time to develop that. It's a first for our country, and I think it'll be leading the world in many ways. And we think that that's just going to be a much more practical, a less invasive way of doing it. And we won't be able to do that everywhere, but we'll use it for those priority cohorts. And I took the opportunity to brief National Cabinet on Friday, whether it be in aged care, people that have got complex needs, little kids. There's lots of examples where you can see this just really driving the testing rate up and being a much less invasive way of getting the data that we all absolutely need. So that's been rolled out in really good time. That's starting today.
Premier, there's been some suggestion that Victoria's Human Rights Charter prohibited the government from enforcing return travellers to have that mandatory test. Can you clear that up?
No, that's not right at all. I think that what people should... people are free to observe that we have a human rights charter. That's a fact. But the charter can be waived. The charter has not been a relevant factor in this at all. I want to be really, really clear about that. This is a strategy that is about delivering the greatest good for the greatest number. And that means sometimes we're going to ask a lot of people. And we don't do that lightly. The mere notion that people are returning home to where they live, to a place where they've paid taxes and where they've made a massive contribution, as much as anybody else, they've simply returned from holiday and they have their liberty denied them for 14 days, that's a big step. We didn't take it lightly. We took it because it's the appropriate public health response. So any suggestion to the contrary is simply wrong. We always want to be fair, though. We always want to be reasonable. And again, I'm not going to stand here and criticise a mother or a father. And that's not every case, but it is probably the biggest group within the not getting tested group. At least that's the advice I have. I'm not going to criticise mums and dads for not wanting their kids to be tested. That's a very personal thing. But that won't be a choice anymore that they need to make, because with the saliva test, which is simply putting a sample in a small bowl, sealing the lid, putting it in the bag and handing it back to the person who's taken the test, that really deals with a lot of those issues, I think.
Can you clarify who is manning the hotel quarantine arrangements, why the ADF isn't involved in that, and can you also clarify whether the government has sacked some of those contracting companies for a failure to adequately manage the process?
There's been some changes over the journey. Obviously there's a number of different companies that are involved, and there'll be varying performance whenever you have more than one company, but I don't have any advice as to detailed contractual arrangements, but I know that there's been, as it's scaled up, there's been changes. There's also been changes based on how well people did their job. Again, I'm more than happy to come back to you on that. In terms of management of hotel quarantine, the Sheriff is in charge of the overall coordination. There's some senior bureaucrats support her in that work. There's then a number of private firms, a number of hotel staff as well. And then there is a really significant presence from a medical point of view or from a clinical point of view, particularly at the hotel where all of the positive cases are housed. That's run by Alfred Health, and it's very much a clinical model because it's essentially like a ward of a hospital.